Well, I don't deal with Kegels. I mean, I had twins 21 years ago, so I've done a Kegel. And I can tell you, they're very of limited effectiveness. And I think with some of our more symptomatic patients, they can't really even do a Kegel exercise because their muscles are so lax or so atrophied that they have no real muscle control. So for those patients, they couldn't even do a Kegel, you know, if they had to. But I wouldn't say any of our patients would call a Kegel exercise very effective management of this problem. Patients who are candidates are patients that are dealing with urinary incontinence, and it doesn't really matter if it's stress, urge, frequency. I've even seen some patients that would be true overactive bladder type patients, or even neurogenic bladder in some cases, have improvement. So the results have been really rewarding, and there are many patients who really call this a life-changing kind of experience. So you might wonder, you know, as a surgeon, why would you want to mess with this? But obviously I'm a female surgeon. I'm an aging female surgeon. I'm a menopausal female surgeon, so I'm dealing with some of the same issues that my patients are, or at least if I'm not symptomatic, I can understand why these would be issues for many of my patients. And as a surgeon, probably nobody understands better the limitations of surgery. So in this way, I'm able to offer something that is meaningful, and in many cases can either put off the time at which they have to turn to surgery, it can help them maintain the results of surgery, and it can be a complement to surgery as well. The EMSELLA would work very well in conjunction with a radiofrequency device that you're using for vaginal rejuvenation, or a fractional CO2 laser that you're using for the same purpose. So whether you do a combination treatment while they're receiving the laser treatments or the RF treatments, you could do the EMSELLA the same day even. One of the things that I'm most impressed with as a provider is how much their lives are changed. I've been told by my patients it can cost $1,000 per year just to supply themselves with pads, not to even mention the disruption in the lifestyle that methodology of treatment, you know, presents. So women who would be afraid to leave the home without pads, women who get up in the middle of the night to change their PJs or their linens. These women are telling you something very intimate about themselves, and when they experience the changes, it just takes a brief minute to see how much it really changes their lives and the lives of their relationships, partners of theirs, on a day-to-day basis.